We co-present our Project Grad 65, which I'll talk more about in my presentation. Let me share. Okay.
Okay, you should be good to go.
Yeah, I see it. All right, let me start the slideshow. All right, and switch. Okay, so we are Hawaii Ship. I know a lot of you in this meeting, so Hawaii Ship isn't something foreign. You're very familiar with our services, but I'm happy to share with everybody in the Gerontological Society what Hawaii Ship does for our Medicare beneficiaries. So we are funded, the State Health Insurance Assistance Program is funded by the Administration for Community Living by a grant. We are part of the Hawaii Department of Health Executive Office on Aging, and a lot of you know people, my coworkers in the Executive Office on Aging, and Caroline Kadirao, our director. And we've been helping Hawaii's Medicare beneficiaries since 1992, and that's when the grant was first awarded to the Executive Office on Aging. And back then we were known as SAGE Plus. The Hawaii Ship is fortunate to also be supported by the MIPA grant, and MIPA stands for Medicare Improvements for Patients and Providers Act. It's also a grant that's funded by the, oh, let me go back. Very sensitive mouse. Oh, and that was too much. There we go. This is also funded by ACL. The grant has been administered by the Department of Health, Executive Office on Aging, I think since 2008. It focuses on helping people who are Native Hawaiian, in the other states, all the indigenous tribes, people who speak English as a second language, and who have limited income and assets. So we help our clients apply for financial assistance if they fall below that threshold, the federal poverty limit threshold, and also people who are rurally isolated. So ACL looks at that as people who reside in Hawaii County and Kauai County. So our mission is to empower, educate, and assist every Medicare eligible individuals, their loved ones, their caregivers, through outreach, counseling, and training, so that they can go out and make cost-effective health plan decisions that optimize access to care and benefits. And this is fancy language for what I'm going to go into in the next slides. So just a little bit of data from 2022. Our Medicare population now is 291,223 individuals. We have 80 volunteers and in-kind staff. And in-kind staff are the staff at the AAA's area agencies on aging. We provide Medicare training so they can provide direct counseling to people who call the AAA's or ADRCs, the Aging and Disability Resource Centers, in all of our counties. We've counseled 2,675 people in 2022, and through our presentations and fairs, we've assisted 6,465 clients. So a little over 9,000 people, which is just a small fraction of all of the Medicare population out there. As far as our rurally isolated clients on Hawaii Island and Kauai, we help 662 people, and people under 65 years of age, and those are people with disabilities. We helped 116 people. And this nice picture here is our first in-person after COVID, where we got to appreciate our volunteers. Okay, so let's get into that counseling, our services. So our volunteers are trained to provide free, local, and confidential counseling and assistance. We are unbiased, which means that we're not affiliated with any insurance companies. We're not going to direct people to purchase a particular plan with any company. We just give them the information that they provide us so they can make the best decisions for themselves. And we make it a point to respond within 5 working days or less, often if a client calls our helpline, they will get a call from our counselor the following day. So what we ask people on that helpline, because right now we don't have a live call center, we ask them to leave their name, contact information, their zip code, because that's how we track people, and the best time and day for our counselors to call back, and the reason why they're calling. And that just expedites the service that we give them. They can also make a counseling request on our website, which is hawaiiship.org/contact, and place a virtual ticket, and we get the information as soon as it's placed. And our staff, Stella, she is the one who compiles all of the requests and distributes it amongst our counselors of the day. So really efficient system that we've devised to help people with their Medicare needs. Another new service that we started during the shutdown is our plan comparisons. We have specialists who will compare Medicare Advantage plans, prescription drug plans, and Medigap policies. And we have this example of our form on the right, where we collect general information, and then we have attachments which ask specifically about any Medicare Advantage information that they want to get from us, prescription drug plans, or Medigaps. When our specialists are finished running the comparisons on medicare.gov/find a plan, which is sponsored by the Centers for Medicare and Medicaid Services, we send them a detailed cover letter explaining all of the research that the specialists found. We also provide side-by-side comparisons of 3 plans that best meet their needs provided on this form, as well as detailed plan information. What's important about the detailed plan information is they can see if the drugs that they're prescribed are part of the plan, is covered by the plan, and finding a pharmacy that they like to go to that offers the best prices. Because believe it or not, you can go get the same drug at 3 different pharmacies in your neighborhood, and they all have different prices. So that's one of the services we provide. We either send them hard copy snail mail. If they give us their email address, we'll encrypt the information and send it off to them by email. Or if they have a fax number, we'll fax it to them, because we need to keep their information safe. A newer service that we just started is our financial assistance. And we have specialists who will screen and help clients apply for Medicaid. MSP is the Medicare Savings Program, which pays for Part A, B premiums, co-payments, and co-insurances, and as well as Extra Help Specialists. And Jane had mentioned Extra Help, which helps pay for Part D premiums, co-payments, co-insurances. That is through the Social Security Administration, and we can help a client if they meet the income and asset levels to apply for that, or through MedQuest for the Medicaid and the Medicare Savings Program. We will help with the application and explain all the benefits just to see if they're eligible, and that will help them save money on their medical and health costs. So we also offer presentations. We did everything live prior to COVID, and then we easily transitioned into virtual because we had already started Zoom. And now we're starting to go back out to the public. A lot of people were finding just love the convenience of a virtual presentation. And so we're still offering those. We ask for a minimum of 5 attendees, and that the request is given to us a month in advance. And you can see in the list below, the bullet points, all of the different subjects such as diabetes and stage renal disease, durable medical equipment, and of course our most popular is the Medicare Basics, which is what we present when we're presenting with Jane in our Project Grad 65. You'll also find us at outreach fairs and exhibits. We always see Rick there because he's volunteers with the Long-Term Care Ombudsman Program. And this is an opportunity for people attending the fair to just ask one of our very knowledgeable exhibitors about simple Medicare questions. We get a lot of, I'm turning 65, what do I do? And so we can just give them a quick rundown of what they need to do, go to Social Security, et cetera, and that gives them peace of mind. So we have a wonderful website, hawaiiship.org, and you can access a lot of resources there. We have multi-language resources provided by the Centers for Medicare and Medicaid Services, as well as the Social Security Administration, as well as ourselves. We have volunteers who are bilingual and have helped us translate materials into Tagalog, Ilocano, and Vietnamese. We also have partner resources. So if you wanted to learn anything about the advocacy and education and outreach section, which Hawaii SHIP is part of, SMP Hawaii, and the Long-Term Care Ombudsman Program, if you visit our resource page, just click on this symbol and it'll give you the contact info for the 3 programs, the ADRCs, Aging and Disability Resource Centers throughout the county, and all of the services offered by the Executive Office on Aging. Anything about Medicare, you'll find right here, financial assistance. In our financial assistance resource page, we have tutorials, video tutorials on how to apply for Medicaid, Medicare Savings Program, and Extra Help that were created by University of Hawaii social work and public health students to help people apply online. They're so step by step. If you don't know how to use a computer, these students will just walk you through everything. It's very educational. We also post on our blog, and the most recent post you'll find on our homepage. In our frequently asked questions, we also have more videos from UH students. And one is the most popular, I'm turning 65, what do I do? This nice pink one here. Well, she'll walk you through what you need to do and ways to apply for Medicare, how to apply online for Part B, and the different enrollment periods for this one, and Medicare Advantage. So they're not very long videos, but really, really informative. Our Medicare minutes are also on the frequently asked questions, which is produced by the Centers for Medicare Advocacy. And there's a range of topics from Medigaps, Marketplace, Part B, Part D questions that you have. Our handouts there will just provide you with the correct information. Be wary about any websites that have Medicare on it, because you don't know who the source is. If it says it's from a government website, US government website, then you're safe. Okay, so we have some upcoming events. This is an important one. This is something new for Hawaii SHIP. We are teaching an outreach college course, and I see Sandra here. So we worked with her and Bob Lipsky to create this Understanding the Complexities of Medicare course. It's a non-credit course offered online, and students will receive a certificate of completion if they participate in the 4-course series. It starts January 24th, next week, and the 26th, and then rounds off on the 31st and February 2nd. So I'm going to chat the link for it, because if you're interested, you can still apply. And I'll do it after my presentation. We're going to continue our free presentations that are available to the public. The first is our virtual open house, and that's just a look inside our hale, our little graphic there, on what you would be involved with if you decide to volunteer with us, and also to show prospective partners the kind of services that they would receive if they partner with Hawaii SHIP. And that's basically educating their stakeholders. Project Grad 65, which I've mentioned a bunch of times, is what we do with Social Security Administration, and it prepares people who are turning 65 and aging into Medicare. So Jane will cover more in depth the Social Security benefits that people are eligible for, And then we follow up with Medicare basics. But what we're doing is we're tweaking our 2023 presentation and doing more of a deeper dive on the initial enrollment period. So that'll be something to look forward to. And a big one is the 2023 legislative session. Hawaii SHIP is so fortunate for the second year in a row to be one of the priorities on the Kupuna Caucus list of bills. We were priority for this year. And what our bill asks for is 3 permanent staff. We've only had 2 temporary staff, temporary because we're federally funded, all the way since 1992. Where Medicare beneficiaries, the people who are eligible for Medicare benefits have increased 300% since 1992. So a lot of people know Candace. So it's me, Candace. We contract out with Stella, who's a very important member of our staff, as well as our part-timer Jazz, to create everything you see from Hawaii SHIP. So if we get more permanent staffing, what it will do is sustain our program in case federal funding is cut, which was on the chopping block during the past administration, presidential administration. And we do a lot of important work just to help people understand Medicare. So it's important that this bill passes. So imagine what it would be like if SHIP services disappeared. We would have eligible individuals not enrolling in Medicare because they're not familiar about this federal insurance entitlement. They won't have a primary care physician to monitor their health. They're not going to use the preventive services covered by Medicare, which is a wellness screening, your other vaccinations and those kinds of things that Medicare covers. If a person is uninsured, and they're faced with a catastrophic illness, they could lose their assets, lose their homes, lower health outcomes if there's no SHIP throughout the country to educate people about maintaining that good health. And that would increase the healthcare costs. It'll increase the rates of poverty among kupuna. More individuals are going to qualify for Medicaid, which means higher Medicaid enrollment and costs to the states. So we'll come out to all of our partners and ask for support when the committees have their hearings to please support the Hawaii SHIP bill. So thanking you in advance for your help. You can see all of our partners. I gotta get a logo from HPGS to add here. I didn't see it when I was looking, but you can see that if we don't know the answer to anybody's questions, these are all the agencies, organizations that we can go to get that answer for our clients, our partners. So we are in good company. And these are very important numbers that you can share with all of the people you know. If they need help from Hawaii SHIP, we have a helpline, 808-586-7299, a toll-free number, 1-888-875-9229. The TTY number is here too. And of course, you can do make a lot of requests on our hawaiiship.org. That's publications, presentations, counseling, and become a volunteer. Help us help others throughout our state to learn more about Medicare. We have lots of fun with our volunteers. They become our friends. So that's it for me. And let's see if there's any questions.
Thank you, Wanda.
Oh, Rick.
Well, I have to ask questions. Yeah. So I learned nobody's listening if they don't ask questions. Go ahead, Sherry.
Wait, not a question. I can send you our HPGS logo, Wanda,
thanks.
for your, And then I do have a question is, can we HPGS link to our website be put on your? I saw the
as one of the resources. Yes, can do. So if you send me all of that, then I'll send it up to our webmaster and make that happen.
Okay.
Yeah, Hawaii SHIP becomes a partner through EOA, not directly. So yeah, I would defer to EOA as our umbrella organization. That's just letting you know.
Okay. Okay.
Yeah.
Thank you. Okay, Rick.
Yeah, sure.
Well, just a few questions. So
Mhm.
I've always learned that nobody's listening if they don't ask questions. So I have a few questions. And these actually come from a variety of places,
Mhm.
folks asking us questions, Kakua Council and back in the Generations Day, that kind of stuff. So, so one thing I've noticed definitely myself is it seems very confusing to have private managed care insurance companies offering to help people select their Medicare programs. Are those companies collecting commissions from the managed care companies? SHIP is neutral, I know. Correct? And is there,
Yeah.
and then being in mental health, what we used to run into, this is in Seattle Mental Health where I was at for 30 years, is people will randomly change and then they lose their doctors, their medications aren't covered anymore. I mean, so could you talk a little bit about the risk of changing a policy?
Yeah.
They make it sound like you need to call us and we're going to help you and save your life. And so people then, I've heard so many stories and I've seen myself where people do change and suddenly everything changes for them.
That seems to be a nationwide problem. I was in a director call and yesterday, and the topic was the open enrollment period last year, which is October 15th through December 7th. And most of the complaints are about marketing of private plans where it's not available, whatever coverage or benefits that they provide isn't for where the person resides. So you can sign up for something and not be eligible for any of the coverage because you live out of the network. So CMS is addressing that. And that's why it's important. I mean, we're one resource. Fortunately, there are a lot of brokers out in Hawaii that are very honest. They really care about their clients, and they will give great service. But there are a handful, and we help should a beneficiary need assistance in changing the plan. We can work directly with the plan or go all the way up to Medicare.gov on 1-800-Medicare and see if we can make those corrections.
And there's a grace period, right, where they can actually back up and go back to where they're at before. Is that still true? Or has that changed?
That sounds familiar, but I can check and make sure. Yeah.
Okay. Well, I'm going to skip. Somebody else had a question here. I'll go to theirs first before I do ours. So, so May, you see her compliments of the new page. Loves it. The information you just shared.
Is that my May? I'm not sure.
I'm pretty sure that's your May.
And I'm her Wanda. I don't owe May. Own me.
It's our May.
I'm her Wanda. Okay.
Mahalo, Wanda, great presentation. Always supportive of people, Medicare beneficiaries.
Yeah, thank you, Kamaka.
And then Kathy, go ahead before I ask these other questions I wrote.
Thank you. Wanda, do you know anything about the Medicare Advantage program that was put forth several years ago about adding adult daycare as a benefit?
Oh, that one I haven't heard in our conferences, but I will look into it.
Okay, please do.
Yeah, because I know, adult daycare.
Okay. And I'm always working on the hearing aid bill. Are there programs that actually cover the hearing aids in a reasonable way?
Well, the Medicare Advantage plans, they've really broadened their coverage when it comes to dental, vision, and hearing in 2023.
They did.
Of course, original Medicare doesn't offer much of anything. Usually it's in medically necessary situations, not the general care that we need to prevent being put into those medically necessary situations. So, yeah.
And are the Advantage plans, do they cost a lot more money? Is there a variance there?
Yes.
Huge variance, right?
Right. So there's zero premium plans and some plans that have a monthly premium. You always still have to pay that Part B, which is $164.90. My short answer is you get what you pay for. So if you need more coverage, it may be more cost effective to pay for that extra monthly premium. But the detailed plan information that our specialists provide, the the
Okay.
client can, you know, really see in depth, like, and make the comparison. Well, this is a 0-1. This one has a monthly premium. If I add my monthly premiums up, it's still more costly, and I only need what's offered in the cheaper plan, or vice versa.
Right. And that's the kind of thing you help a person decide or work with, right?
Yeah.
Yeah.
Yeah. So on our form, we have all of the plans available in Hawaii. They will indicate if they want certain ones or all of them. And so our
Okay.
specialists will look at, I mean, really scan what's the information that comes up, and then make that deduction as to what is going to cover their healthcare needs.
Okay. One more down here. Let's see. Lonnie, do you want to ask your question? You want me to read it?
Oh.
You're welcome to ask it.
Not a question.
Oh, yeah, this is what
Oh,
you're
not a
talking
question.
about. That's the answer.
Yes,
That's the answer.
Yeah,
There you go. Oh, I'm sorry.
about the
Well,
grace
thank you.
period. Yeah,
yes.
Right.
Lonnie, you want to
your second chance.
Sorry, Sherry.
You can let us know verbally what you just
Okay.
wrote.
Yeah, there was a question regarding once you enroll in a Medicare Advantage plan and you find that your drugs aren't covered by the formulary, or your doctor is not participating in the network for that particular, you have an opportunity to switch to another Medicare Advantage plan, or you can actually go back to original Medicare Parts A and B.
Okay.
And when, if
Yay.
you, so we strongly encourage you to sign up for a Medicare Part D plan so that you have drug coverage, because in Hawaii, Medicare Advantage plans, also called Part C, they are built in with a drug rider. There's only one plan that's offered through United Healthcare for TRICARE members that does not contain a drug rider. But otherwise, for the most part, everyone is safe if they enroll in a Medicare Part C plan. But if you're going back to original Medicare during this Medicare enrollment period, Medicare Advantage enrollment period, you're going to have to select a separate drug rider or standalone drug plan, because original Medicare does not provide drug coverage.
Yeah. There's a lot of alphabets, Lonnie. And
Isn't there?
What is
the
plan?
ABCs of Medicare.
Yeah. There's a plan N as in Nancy, and I don't
that's
know
a
why we
Medigap.
chose it. Is that something that we need, people should have, or what? I don't know
As
why.
in Nancy would be a Medigap plan. So that would mean that you have Medicare, original Medicare, just A, B, and D. Is that
Yeah, so
correct, Sherry?
Medicare. Yeah, so Medicare A covers hospital. Medicare B covers doctor services or outpatient services. Medicare C is Medicare Advantage plans, and Medicare D covers prescription drugs. If you choose to stay on original Medicare, which is A and B, not only do we recommend you sign up for a standalone Part D plan, but also you have the option to add on a Medigap plan, which is also known as a Medicare supplement plan. And that's the one that you actually have to purchase through a Medigap broker. And there's plans A through N that you can choose. And there's a lot of plans. And they differ in terms.
You got muted somehow.
Oh, you have to speak into your mic, but I think she said
I'm so sorry.
the coverage change.
Hear it when my mic's on top of my head. I'm so sorry.
It was going
I'm
so
so
well, too.
sorry. But yeah, Medigap coverage is really, Medigap plans in general are really understated, and it's like the best kept secret, because when you first qualify for Medicare, whether it's through a disability or turning 65 or retirement, whichever one it is, the time to enroll in a Medigap plan is during your initial enrollment period, because there's no underwriting. They don't ask you what health conditions do you have or anything like that. It's like what we call a guaranteed right period. Once you've been on Medicare and say down the road you develop some chronic conditions, which is very prevalent as we age, that's when you might want to look into Medigap plans, adding a Medigap plan, but underwriting is then going to be done, and the price is going to be based on your age as well as your chronic conditions. So it's one of those things where if you kind of have some conditions going on at the time of your initial enrollment, we strongly would steer folks toward considering adding the Medigap coverage onto their original Medicare.
So
And
there's two things, right?
Lonnie.
The original Medicare versus Medicare Advantage. So if you live in other counties other than Oahu, where there's very few Medicare Advantage plans, it's sometimes more beneficial for a resident there to enroll, to stick with original Medicare and purchase that Part D and the Medigap. Or if you live sometime in this state and sometime in another state where you want to go get medical coverage, healthcare, go visit a doctor, then original Medicare may also be a good reason to stay with that instead of getting a Medicare Advantage plan and having a hard time just getting general care when you're living in your other state. Yeah.
Wow.
I think a general takeaway, and Rick, you kind of hit on this. This is just tough. This is just really complex. And I cannot tell you guys how fortunate and blessed we feel to have volunteers who have wrapped their head around Medicare, Medicaid, Medigaps, marketplace plans, low-income subsidy program plans. And like Wanda mentioned a couple of years ago, we began to develop specialists who could help with Medicare supplement plan enrollment and eligibility, as well as extra help specialists who could help with that program's eligibility enrollment. So we have an amazing group of volunteers that are quite frankly intimidating to me. I mean, they care so much. They're lifelong learners, and they really, really care about giving back to their community. And they understand that when it comes to Medicare or health plan coverage, there is no such thing as one size fits all.
Yeah.
There just isn't. And yet many times we ask our neighbors and we ask our siblings, what do you have? Is that good? But you know what? I've yet to meet two people who have exact same health conditions, taking the exact same medication. They have the exact same married, single, divorced, widowed with retirement benefits, spousal, but pension. There's so many different factors. Do they have kids? Do they own their home? Do they have assets? We actually screen and go through all of that so that we can then present the best 3 options based on that individual's number 1, healthcare needs, number 2, their budget. We would all love to afford a Cadillac plan, but sometimes that's not possible. But that's not our decision. We present it and they then make their decisions. And then once they make their decisions, we actually help them enroll. So this was super helpful. Like Wanda mentioned, we actually started Zooming prior to COVID. And so by the time 2020 rolled around, our services it was completely transparent as far as we were now working at home. It was all done remotely because we had cell phones distributed to our volunteers in the community. They all knew how to Zoom. We called them baby Zoomers. It was fabulous, and we were just lucky because we were so ahead of the game. But it was a critical time for many people because sometimes they lost their jobs involuntarily and they needed to enroll. Social Security was inundated and their phone lines went down, which is why, as Jane mentioned, the Equitable Relief Program was introduced. And then, of course, the creation of the Affordable Broadband Internet Program was started so that folks who weren't online and couldn't afford internet could now afford it. So a lot of good things, the silver linings of the whole pandemic.
But now you really need to have the staff now because you're being bombarded with baby boomers aging out.
Without a doubt.
Yeah. So my last question was, and you've hit it, Lonnie, and certainly Wanda, you've touched on this. So it's so complex, the Medicare system. Is there any hope of ever simplifying this? I'm concerned that the individual that's actually aging out, as I will be, and losing my mind, is not going to be able to understand all this stuff. And so without a ship or even being aware that someone's out there, it's just you're lost. You're trying to swim to the surface and can't reach it. It's so complex.
Lost at sea.
Yeah. Is there any hope to ever simplify?
What I've noticed is that CMS and the current administration, they are providing more extended special enrollment periods on certain situations. So to
Okay.
avoid that late enrollment penalty,
Yeah.
they've just introduced an insulin cost savings program where if the insulin is covered by the plan, then it's just $35 a month. So
Okay.
they're making, it seems like they're trying to make things simpler.
Good.
Yeah. And we are fortunate to always receive support and education from the Administration for Community Living and Social Security and the Centers for Medicare and Medicaid Services. And that's what we bring back to our volunteers.
Right.
Exactly. I think that's one of the biggest advantages is we're a direct pipeline to the
Mhm.
Center for Medicare and Medicaid Services, the Administration for Community Living, Social Security, obviously with Jane. And so the information and resources that we connect our kupuna with are accurate and they're relevant. And we actually will go out and do broker education when the health plans call us to do presentations or exhibits for brokers who are going out and helping kupuna. We will do that because we want to make sure that they give the accurate information. We don't have anything against brokers unless they misrepresent their plans, of course. But you know, they have a special niche there because many times they don't only help kupuna with their healthcare options, but also their financial decisions. So, you know, and especially for those who aren't married or don't have kids or don't have a support system, they really do need that guidance.
Right.
Yeah, but you know, like Jane, I think I'm so sorry. I like Jane touched on a little bit. In order to sustain the Medicare Trust Fund, things have to happen, right? Cost containment measures have to continue to happen. So, for example, with the huge Medicare costs during the COVID pandemic, I remember telling staff, be careful because either the premiums are going to go through the roof or the benefits are going to go down because it really affected so many older adults and the exorbitant hospital costs of treating COVID patients. But, you know, fortunately, it took a little bit of a hike in 21, but then it came back down in 23. So I think we've kind of leveled out and we've survived that storm. But every year we continue to see changes, whether it be additional benefits or higher premiums. And so I guess the short answer to that, Rick, is that there is no calm seas as far as
Yeah.
Medicare is concerned. And, you know, I've been doing this for over 30 years and I don't consider myself a subject matter expert because it is constantly evolving and changing. And, you know, we just have to stay on top of it. If we don't stay on top of it, we can't help our clients.
A few years ago in Legislative Kapuna Caucus, I forget who it was the insurance commissioner or somebody, maybe Kathy, maybe you remember, they were talking about that insurance isn't going to be able to afford to stay in business. It was a very scary presentation with all the baby boomers aging out. So
yeah,
so
no,
hopefully,
I think there are cost containment measures. You
yeah,
know, Medicare is not mandatory.
no,
Medicare is an option.
yeah,
And it's a nice option, especially if you've earned it through your work. But yeah, you know, it's a fiduciary's nightmare, I guess, where they have to
yeah,
balance the benefits that are being paid out versus the
right,
premiums projected to be collected. So, but we will stay on top of this. And,
right,
you know, we would love to have additional staff who can help us take a look at the statewide data of Medicare beneficiaries, look at
right.
utilization, look at risk factors so that we can inform everyone, including the legislature, on what's happening in Hawaii.
So last question, because we're running out of time. We're actually gone over a little bit here.
I apologize.
No, this is very important information. Very, very important. So if you don't actually sign up for Medicare by age 65, then you're penalized as far as your costs for the rest of your life. Yeah.
As long
Yeah,
as
you're
you have
banned
that,
from ever
yeah.
enrolling. I'm kidding. I'm kidding.
That would be a huge penalty. You can't if
Yeah.
you don't enroll. But yeah,
Right.
so 10% is Part B based on the number of months you weren't enrolled, 1% for Part D. And then if you didn't work those 40 quarters and you're not eligible for premium free Part A, then there's a late enrollment penalty on that too. But that's only twice the number of years that you weren't enrolled in Part A. So even that isn't like a one size fits all, you know?
Right. Oh, yeah.
Yeah, every little aspect. You know, before we go, I chatted the link to our outreach college course and on my email address. And the reason why I brought down my screen is I want to promote our computer basics for Kupuna 2. If you would be interested in, see, I can't even do selfies, you guys. If you're interested in getting this and the computer basics 1, just email me. I'll send you a digital copy, or give me your mailing address and I will send you hard copies. How to create a My Social Security account. This is what Jane talked about and how you do it step by step. We have it
Wow.
all here. So we'll
Very
be
good.
happy to send it to you and to whoever else you want to give their names up for us.
And
And
that's on your webpage too?
I'm going to be putting this on my webpage, on our webpage.
Okay.
So sorry, but the CB one is on our webpage in our resources
tab.
tab. Thank you, Lonnie. As well as all of our newsletters, et cetera, et cetera.
We
So-
just finish each other's sentences.
Yeah.
The computer basics, we call it CB. The CB2 issue also has information on the Affordable Connectivity Program,
Mhm.
which is continuing after the pandemic ends. Yeah,
So
lots of good
things to
stuff.
look forward to in future editions is how to sign up for a Medicare.gov account. Why isn't it's important? You know, let somebody else track all your prescription drugs and all of your medical history there in a safe safe, you know how things go.
Confidential, yeah.
Yeah, confidential environment. So thanks again, Kathy, Rick, Sherry, and all of the Gerontological Society for having Hawaii Ship speak with you today. And thank you, Lonnie. You
You're
gave that
welcome.
grace period. I forgot about MAOEP. My goodness, we're in the middle of it.
Thank you guys so much
Absolutely.
for all the great information.
And you know how to reach us if anybody
Yes.
has any questions.
Yeah.
Thank you for joining us. And thank everybody else for sticking with us for all this wonderful information. You've got her, Wanda's email address. You know how to get a hold of us. So call if you need anything. Thank you so much and have a great day.
Thank
Thank
you,
you so much.
everyone.